You are discussing periodontal disease and treatment options with a Spanish-speaking patient and working with an interpreter. You know a few words of Spanish from a high school class and a one-week trip last summer. The interpreter is using a lot of words, including some technical ones, and you think the interpreter is giving advice to the patient and that the information isn't accurate. How do you proceed? In this type of case, here's what's important to remember. As an oral health professional, you have a professional responsibility to obtain informed consent and respect patient autonomy. This means you need to be sure the patient has accurate information about her health and the options for treatment, and that she also understands it. I think one of the most difficult aspects of needing to communicate through another person is the inherent uncertainty of just not understanding another language. You really need to trust your interpreter.
Both trust and respect are essential. So in this case, as the provider, you should share your concerns respectfully with the interpreter. What you might say is something like, "It seems that the interpretations are longer than what I said. Is there anything else you said to the patient?" Or another strategy would be to ask the interpreter to interpret back what you just said to the patient. Of course, being mindful of your tone of voice and keeping it respectful. One thing important to know is that languages are often quite different from each other in terms of structure. So phrases may be either longer or shorter in the interpretation than what you said originally.
I also think that knowing the level of training your interpreter has can be helpful. And this is something you can ask about during introductions at the beginning of your appointment. I feel this can set the tone for what follows and builds rapport between the provider and the interpreter.
When providers welcome me to the team during introductions and inquire respectfully about my training, I know I am likely to be working with someone who really understands the process. And all of that is better for the patient.
An interpreter was booked for your appointment with a Somali-speaking patient. It is his first appointment with you. He speaks some English, and you bring him back to your cubicle, telling the front desk to let you know when the interpreter arrives. The interpreter does not show up. However, another provider in your clinic speaks Somali and is seeing a patient in the operatory next to yours. How would you handle the situation? What are the concerns and risks involved from your perspective and each stakeholder, the patient, your colleague, and the profession? What's important to consider here is to be aware you are interrupting another patient's care and that your colleague may not be a trained interpreter. In this case, your colleague could and should help the patient understand that without an interpreter, they will need to reschedule the appointment.
As in the previous scenario, knowing the level of training, or in this case, language proficiency, is extremely important. If someone is not a native speaker, be sure to ask how well they speak the needed language. If your colleague is available but not a trained interpreter, they should still follow the standards in the Interpreter Code of Ethics.
I think this is an opportunity to point out the complex nature of interpreting skills and the importance of working with professional interpreters and setting this as an ideal. All the while noting the reality that situations do occur that are less than ideal and where, as clinicians, we need to find alternatives to meet patients' needs as best as we can. For example, sometimes simply rescheduling is a reasonable option, yet there are other times, as with serious emergencies, where the risks associated with sending the patient away to return later with an interpreter are too great.
Knowing your resources for alternatives or backups, including the pros, cons, and risks, in this case is important, as is having those available when the situation occurs.
A Hmong-speaking patient comes to his dental appointment and brings his 12-year-old nephew with him. The patient doesn't want an interpreter because his nephew speaks English and will interpret when needed. What are the considerations? Considering the issues around using ad hoc interpreters, I think it's important to note that the patient's nephew may not have the maturity or knowledge to communicate complex medical or dental information, and no matter what the age, there's potential bias when a personal or emotional relationship exists.
It's not fair for children in particular to be asked to do something so complicated and complex, let alone having to witness treatments or pain of a parent or a relative. Matter of fact, it's not uncommon to hear these children, now adults, talk about the stress and worry they felt having done this in their childhood. Also, friends and family are often not the best interpreters and are prone to edit and omit information and even direct decision making, and this can have sometimes serious negative consequences.
Think about a treatment planning appointment, for example. You may be presenting treatment options to the patient, including risks, benefits, prognoses, and costs. Important information for decision making. A family member may not interpret each alternative, therefore directing the decision to what they think is best for their relative. In dentistry, this may not be a life and death kind of situation. However, it doesn't take much to imagine a scenario where critical medical information gets left out that could adversely affect treatment and patient outcomes in more serious ways. A Russian-speaking patient comes to the clinic for an urgent dental problem. You are tasked with reviewing her medical history as well as her chief complaint. The patient assures you she doesn't need an interpreter. As you go through this process, you begin to question her ability to really understand English. How do you proceed? It is not uncommon to see this in clinical settings. It's important to respect the patient. However, you also need to be certain the information you provide is understood. One way to assess this is to ask the patient to share back what you told her.
As an interpreter, I sometimes stand by in the room in these cases. One thing you might say to the patient is, we can have the interpreter present just in case and to ensure things are clear. In this situation, as an interpreter, I stand by and pay attention. Then, when the provider asks the patient to share her understanding, I'll step in if there is a confusion.
You have joined a practice in a rural area that employs a large number of recent immigrants with limited English proficiency. You approach the owner dentist about the process of booking an interpreter for your patients who require one. The owner dentist responds, "It isn't a problem here. I know what the best plan is and always do good work. Plus, many of these patients come with family or friends who are happy to translate. I've never had a problem. Do you have concerns? How do you respond?" This is a challenging situation on a number of levels. In this case, you need to somehow communicate the importance of having a trained interpreter and this is why, and do it without judgment. First and foremost, it's a matter of professional ethics, specifically informed consent and autonomy, and justice. We must provide quality and safe care for all patients. It is also good risk management. Even if you're not aware of a previous problem, you're at serious risk for miscommunication that can lead to negative patient outcomes, legal action, and/or financial loss.
I would share with your colleague that family members are often not the best interpreters because they edit, they omit, they change, and they add information to the communication. There are also legal obligations, which is off of the Civil Rights Act of 1964. Healthcare providers, including dentists, are required to provide language access, including interpreters, if they accept federal or state dollars as payment for services. Also, interpreters are guided by the Interpreter Code of Ethics, and I think many providers are unaware of that.